All right. Hi, everyone, and welcome back to the Comcast. We're here with a brand new episode and with a brand new guest. Why don't you introduce yourself?
Hi, my name is Lord Dickey. I live in Flagstaff, Arizona, and I'm currently retired.
And for those of you who may not know, could you maybe briefly summarize your maybe experience, your area of expertise?
Sure. My area of expertise is working with transgender people. I'm a transgender individual myself. I transitioned in 1999, so quite a few years ago, um, before it was so-called popular the way people think of it today. Um, and I worked in the field of psychology for about 10 years, doing research on the lives of trans people and presenting and helping to break down the barriers that some trans people experience when they try to access care. And then finally, just basic uh, training for mental health providers. And part of that entails many years of um, writing as well. So books, book chapters, journal articles, the whole 9 yards.
Yeah, what's funny is I actually was doing research for a blog that I was writing for my website, and I came across something that you had written, and I noticed your name, and I was like, "Who is this person?" So I looked into you, and that's how I found you. But I'm always
Yeah,
going off on rabbit holes.
yeah, I do the same thing.
Oh my. Well, all of that is really awesome, especially because, back in the 90s, like you said, it was definitely a different time than it is now. It's definitely more celebrated to be, in the LGBTQ community in general than it was back then.
I would say in 1999, Seattle was more progressive than Arizona is today.
Wow.
Even though that was a long time ago, I could pretty easily find providers that knew what they were talking about, where today we have states banning transgender kids from participating in sports and making it a felony to provide anybody treatment. I mean, there's some really awful things that are happening right now in the world that make it hard to want to be out as a trans person.
Yeah, that's something I consider a lot in my work at COM, but also in the partnership organization, Humanity Rising, that we're through. It's crazy. I get news articles every day from my team that I'm just like, oh, something new. Great.
Yeah.
It's crazy. And while we're sort of on the topic of those changes and those barriers, based on your experience, I mean, would you say that societal factors, whether that be discrimination or just general injustice, influence our mental health?
Oh, absolutely. I mean, there's in many ways there's no way that it couldn't. Because imagine every time I walk out the door, if I'm read as a trans person, which I'm not, um, you know, uh, that's going to increase my anxiety because I'm not sure whether how I'm going to be treated, and if that treatment is even going to be violent in any way. And if I'm having to do that day in and day out and justify my existence, it makes sense that it would become depressing as well because you're constantly fighting an uphill battle and you're not able to see a place where you clearly fit into the schema of the society, community, neighborhood, however you want to say that you live in.
Yeah, I feel like that's really hard. I mean, for adults in general, that can be difficult, whether it be, like you said, a community or a neighborhood, but also a workplace, an educational institution, wherever you are, that's something that you sort of have to keep in the back of your mind. And I feel like, yeah, I mean, that definitely is exhausting. I call it like living in a state of alertness almost.
Yeah.
Yeah, like just constantly being vigilant and having to, think about, is this group that I'm interacting with going to treat me properly just, because I'm a part of the community?
And the chemical in the body that comes with anxiety like that is called cortisol. And if we are constantly on alert, we have high levels of cortisol that can lead to all matter of other health issues that we wouldn't otherwise be subjected to. Now, I'm not a medical doctor and I can't really speak to all of that, but I know enough about it as a psychologist to be able to say that's not a place where you want to be all the time, is in a constant state of stress and anxiety, because it's going to have implications for you down the road in terms of your health and well-being.
Yeah. From personal experience, I can definitely speak to that. In the past had been diagnosed with various mental health conditions, but a lot of them brought anxiety, especially after I was diagnosed with an eating disorder. It was a very prevalent thing that we had to work on because that's one of the things that was sort of fueling it was this constant state of needing control because I was so anxious. So yeah, definitely would not recommend it to
Yeah.
anybody.
Yeah.
Yeah. Um, and that happened when I was like 14. Um, but just in general, you say that there could be long-term effects, and that's something that you look into, as you're a kid and you may be developing, anxiety or depression because of these societal factors. It's especially in the community, it's a big problem. I know that transgender youths are faced with a lot of mental health challenges, more so than cisgender youth. Not saying that neither, is more valid or severe than the other. It's just a matter of prevalence. Something that I read was like in the Trevor Project, the 2022 survey, which was their most diverse survey yet, according to what they say. I'll take their word for it. But they found that 69% of transgender boys experience symptoms of depression, while only 41% of cisgender boys had those similar symptoms. Would you say that like transphobia towards youth is contributing to those disparities?
Absolutely. And I think it happens regardless of whether or not they have a supportive home environment. Obviously, if you have a supportive home environment, you're more likely to have positive outcomes relative to decisions to start on puberty blockers, or if you're old enough to be able to start hormones or to have any kinds of surgery um, with parental permission if you're younger than 18. Um, but you won't find very many surgeons who will do surgery on someone who's under the age of majority. And of course, in the US, that's 18. If a child is struggling to be accepted at school, they're experiencing bullying, their teachers are using the wrong names and pronouns, they have to go to the so-called nurse's office to use the bathroom. Um, those are, I don't even want to say slights, because slights kind of minimizes how difficult all those experiences can be. But those are the kinds of experiences that over time just keep adding up and adding up and adding up. And by the time you get the whole pile of those, it makes sense that somebody's more depressed than their cisgender counterparts. But I have to say, those levels of depression, both for cisgender kids and for trans kids, seem super high to me. Like almost half of cisgender kids are experiencing clinical levels of depression. That's scary to me that it's that high. And of course, even more than that for trans youth. And we know that in trans people, and most of these studies have been done in adults, not children. So I don't have exact data for children on this, but over 40% of trans adults in two different surveys conducted by the same organization, but two different surveys indicated having had a history of attempting suicide at least once in their lifetime. And I can imagine, our thinking brain, our prefrontal cortex, the part that's good about making executive decisions, isn't really done developing until we're at least 25 years old. So a 14-year-old who's really struggling with fitting in and maybe doesn't even have support from their parents, it makes sense that coming up to a decision point of should I keep on living? And if there are access to guns in the home, that makes that question easier to resolve. And it's scary to me how many people have at least once attempted their life. And I can't imagine what those numbers are like for children and youth. And to be in a place that you are in so much pain that you think that's your only option. Ultimately, I think somebody has the right to end their life if they want to. I just don't ever want them to be in so much pain that they think that's their only choice.
Yeah, it's devastating, not only for obviously them, I mean, because you never know what corner your life is going to turn. Things could change at
Right.
a moment's notice. So it's definitely not the solution, but unfortunately, when you're in that mindset, it can seem like the only way out. But
Yeah.
it's also unfortunate for the people who are left behind. And I've definitely noticed a higher prevalence of just suicide, not just in the community, but among youths in general. I mean, what I, graduated high school or whatever, but when I was in high school, there were 3 or 4 kids within the span of 2 years. Two of them I knew personally that took their own life. And I think it's also a matter of kind of off topic, but a matter of response as well. Um, I'm not going to get into the whole story because that's not what this is about, but it was obvious that this is becoming something that's in common day discussion, but it's also something that is becoming more common that people are less surprised by it. And I don't know if that's a good thing or
I don't
not.
think that's a good thing.
No.
I don't, and I was talking about our executive functioning, and a 14-year-old isn't anywhere close to being able to have that kind of problem solving skills and ability to make decisions for themselves that are at least somewhat forward thinking. Suicide is not what I would call a forward thinking decision. And I also understand firsthand being in that much pain and thinking that that's your only choice. But I know that there are other options. And then the question becomes, if the child reaches out for support, who do they get it from? Mom and dad may be supportive, but this is as new to them probably as it is to their child. And how do they support let's stick with an adolescent, how do they support their adolescent when they don't even know how to get their own questions answered? And I suppose if you live in a relatively big city, in a relatively liberal part of the country, you can probably find some good providers. But people ask me all the time, who are the hormone providers in Phoenix, Arizona? Phoenix is the fifth largest city in the country. And people can't figure out who's going to provide hormones for the trans people who live there. How do you respond to that? How do you deal with that? And, for me, when I hear that over and over and over again, it wears me out. And so I lose my own resolve around how to make things different and better. There's one part of being an elder in the community or someone who people look up to, and that's that I feel responsibility to do the work that I've been doing over the years. And at the same time, that is exhausting.
Yeah, feeling the whole weight of maybe a community on your shoulders. I mean, no matter, at least it's in my opinion, that no matter how much you can accomplish or how much you know or how many degrees you have, everyone is just one person and nobody can take on more weight than really themselves and what they want to accomplish as a person. And, as I have always had these like perfectionist tendencies and a need for things to be exactly as I want them, people pleasing. I've been through all of those loops. And that's something that I have been told a lot is, you just can't put everyone's world on your shoulders. It can only be yours. And I'm like, I'm working on it. But yeah, that's not a very productive way, but I mean, it makes sense why you would feel that way considering the work you do.
Yeah.
But yeah, and sort of to go back on topic, but I love the conversation we just had. I'm keeping that all, the whole thing in. But to sort of switch back onto the topic, thinking about all the things that youth are going through right now, thinking about sort of, I mean, just everything that's happening in this country right now, but also that's just been happening for years and years and decades, all of that stuff impacts young people and minors and adolescents. But, even once we're done with that, it still affects us and our childhood experiences still impact our lives. What psychological issues, may transgender adults have due to maybe transphobic experiences that they had in childhood?
Certainly, post-traumatic stress disorder is a possible option depending on how people were treated. If you're being bullied, and depending on how violent that bullying is, that can easily be a traumatic experience for a child. The threshold for trauma for children isn't as high as it is for adults. And so, we're looking at a benchmark in terms of uh, trauma and trauma experiences that makes it really, in some ways, too easy to meet, right? And then, depending on whether or not you got the support that you need to work through that, you may be starting to look at that kind of clinical or mental health concern pretty early on in adulthood. So, trauma is one piece. Depression and anxiety, we've already talked about. And you've talked about how in your own life, the sort of sequelae of disorders can include disordered eating. It could include other obsessive compulsive behaviors, which is actually a kind of anxiety disorder when it's not the personality disorder, when it's just the OCD. Because when we feel compelled to do things, that's our anxiety that's trying to get us to resolve whatever level of anxiety that we're having. And then when we put those things in order, whatever that is, or we do that thing, say, wash our hands, that's supposed to make us feel better until our anxiety rises up again. And then we find we're back there washing our hands again, or reorganizing that row of books that's in our living room, or
You're looking into my soul.
or alphabetizing our DVDs or our spices, or organizing our closet. I could go on and on. I know what these are. really well. But one of the things that's important to attend to is that someone could have experienced trauma and they could experience flashbacks and maybe some of the other symptoms of trauma. But if the person isn't distressed by that, it isn't a clinical concern. So any of the mental health concerns, depression, anxiety, OCD, PTSD, any of those, if the person is not experiencing clinical levels of distress, it's not diagnosable. So I like to be really cautious around someone comes in and says, I'm depressed. And the first thing I ask them is, what does that mean to you? And then I'm comparing what they tell me in terms of symptoms with what I know is diagnosable in the DSM, the book that's published by the American Psychiatric Association that lists all of the different mental disorders. And then that way I can help them work through, is this really depression or is this something else? Is it subclinical depression that if we don't pay attention to what's going on, then it might become a clinical concern. And we, of course, don't want that to happen if we can prevent that. So I want to know, okay, these are the kinds of things you're experiencing. Well, how does that affect you? How does that affect you going to school? How does that affect you going to work? How does that affect your relationships at home? What about your friend group? What about the peers at school? So there's all kinds of ways to sort of drill into that information to try to determine whether or not a person actually has a clinical concern.
That's interesting because I have gone through, I want to say two or three psychologists and then two psychiatrists, I think, because I know that there's a distinction there. And I hadn't heard it like that before, like someone saying it directly to me. It's more been like them probing and asking the questions. And then I'm like, answering them. But it's cool to see how like that's what is happening.
Well, I mean, that's how it should be happening.
No,
Right.
just imagine just like here, fill out this form, check, 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 and that's your diagnosis. Like,
Yeah.
I'm not saying that's happened to me before, but it's came close. But we actually, speaking of care and all these different factors, I, something that you mentioned a few minutes ago was that doing the work that you do, it can feel like there's a lot of pressure because of that. And, correct me if I'm wrong, but just out of curiosity, would you say it's like maybe because of the lack of work and the need for there to be more work? Because I feel like there are a lot of studies on various different things and a lot of work on mental health in general, but in terms of like specifically targeted towards the LGBTQ community, would you say that there's maybe a lack of it?
I wouldn't go to a lack of it right now, and that's because in the last 10 to 20 years, you've had almost an explosion in the numbers of journals that specifically address LGBTQ plus people and their concerns. You've also had additional funding become available through the federal government. Now, there's still some problems with that because they tend to fund studies on race and ethnicity before they do sexual orientation and gender identity. But some people have been successful in getting funding through the federal government, and that right there is kind of a whole game changer in terms of how much reach you can have in your study and whether or not then you can make those results generalizable to the general public of LGBTQ people.
That's interesting. I know that um, I mean, that's really interesting coming from when do you, out of curiosity, do you know when the government started doing that? Like when that funding was implemented?
It would be whatever year the National Science Academy, I think that's the name of the organization, put out a booklet. They were specifically charged with studying what needs to happen in LGBTQ research. And one of the recommendations they made is there needs to be an increase in funding. And that came out while I was in graduate school. I want to say maybe '06 or '07, somewhere in that area. It was definitely before 2010. But they were saying we need to know the need. We can't make policy decisions or funding decisions on how to address the needs of people if we don't know what their needs are. And I don't know if you've paid attention in the last couple census administrations, there's been this question of, do we ask people about their sexual orientation? Do we ask people about their gender identity? Well, I think this last time we asked about sexual orientation, but we didn't ask about gender identity. So we don't really have good data, good population-based data that tells us how many trans people there are. The Williams Institute would tell you it's about 1.6 million in the US. And I'd have to go back and look at their reports to understand their exact methodology for how they came up with those numbers. But the truth is, we don't really know. A country like the Netherlands, where there's socialized medicine and people are all going to the same place to get their care if they're trans, relatively easy to count how many people are getting care. Not so in the US, because we have this completely decentralized version of how we do medicine in this country. And, unless I tell somebody else that's what I'm doing or what my story is, they have no idea. It's between me and my doctor. And my doctor works within a system, but it's not like she's just going to go talk to everybody in the system about, oh, I've got this new transgender patient, da 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 da. Like, okay, what happened to HIPAA? What happened to my right to privacy? So we lose some of that ability to keep track of how many people there are and how to meet the needs that they have. Maybe all transgender people need to have orange shoelaces. I don't know. But we won't know that until we ask the question. Now, I know I'm being a little bit silly, maybe a lot bit silly, but the point is, how do we know what to do and help people with if we don't? How do we know what we don't know when we don't know what we don't know? Right? Say that 3 times fast.
Probably couldn't. I'd stutter at some point.
I mean, I can because I ask that question all the time. How do I know what I don't know if I don't even know what I don't know? I don't even know how to ask those questions. So that's why it's also important when it comes to doing research to choose a model of research such as what's called participatory action research, where there's essentially a committee of the very people who you're interested in finding out information about, who are helping to serve almost as an executive committee over your research. And they help drive the questions that you're asking. They help get access to the community, but you have to be able to prove yourself as a legitimate ally or member of the community before you're going to even be able to pull that group of folks together.
That's true. I mean, when you brought up the census, something that came to mind is like honest reporting, because maybe people are, transgender or LGBTQ just in general, but they're not out of the closet, they're not open about it, so they're not going to report it. So
Right.
yeah, that
Right.
makes a lot of sense.
Right.
Definitely. But yeah, I mean, in terms of like, we you sort of discussed the issue with sort of solving that problem, but what are some maybe ways that maybe people in the academic field or mental health professionals or just in general can maybe combat that issue and just combat discrimination for trans youth in general, maybe just within their own practice. Maybe it doesn't have to be on such a large scale.
One of the first things I would say is, and I wasn't really explicitly trained this way, but as mental health providers, we can be phenomenal advocates for the people that we see or the people who we might see. So when there are stupid bills that are being proposed by state legislatures, absolutely start writing letters to your elected officials about why this is good or why this isn't good, so that they can hear from you, and they're not going to know what you're thinking about it unless and until you speak up. So the importance of saying, hey, this isn't okay. There's no reason why children shouldn't be able to play sports against one another. If there's a question of something being unfair, we'll figure out how to make it fair instead of just saying we're going to ban participation, right? Because that's what is happening right now on multiple levels. And what's so scary for that, but to me, is that you end up creating this second class of people who aren't allowed to do the kinds of things that they would generally enjoy doing because someone who is afraid that someone's going to remove their own penis, because that's not what being trans is about, right? Someone's going to change their genitals, maybe, but not even always. But the people who are making these decisions are not trans people. They're uninformed or not well informed cisgender people who have a fear of something that they just don't understand. I mean, that's been true of all kinds of social concerns that we've had in this country over time. The right to vote, the right to marry a person who's outside your racial group, understanding the differences in gender roles. I mean, some of these are the ways we relate to people on a day in and day out basis. Others are fundamental and important rights that we have as human beings. Why shouldn't I be able to marry a person who I love and not have to worry about being policed about what their gender is or what the color of their skin is? Now that the Supreme Court has taken out abortion rights, they struck down Roe versus Wade. What's next? Lawrence v. Texas, that's what outlawed all the sodomy laws that were still on the books in this country. The Obergefell decision, that was a same-sex marriage or marriage equality decision. And, it's almost like LGBTQ people are sitting in their living rooms, holding on to their chair or sofa with white knuckles, just waiting for the next shoe to drop on how their lives are going to be impacted. Because as long as we're part of a minority group, we're going to have to rely on our allies to get change made. And that means doing a whole lot of work.
Yeah, that can be so overwhelming. I think one of the first podcasts I ever did was about that topic, about leaning on allies, but also making sure that you're choosing the right allies to lean on and, making sure that the distinction we sort of made in that episode was the performative ally versus somebody who's a true ally. So somebody who's like, well, it's trendy to support the LGBTQ community versus someone who actually supports and cares about the legislation that you're mentioning. So yeah, but definitely that overwhelming portion of it. I think maybe if I wasn't so involved day to day, it would maybe bother me more. But I mean, I do this day in and day out, and I wouldn't say I'm white knuckling a chair, but I have those news alerts on, and it's something that's in the back of your mind. Like, am I going to have to change the way I live because of some decision I have no say in? It's definitely stressful.
Right.
And, there's a lot of kids, there's a lot of teens that maybe are listening or will watch this or are just out there in the world somewhere and don't know how to deal with that stress or don't know how to deal with this, that overwhelming sense of fear, maybe that, comes with the territory of being in the LGBTQ community. And I always ask guests, like, do you have any advice for those people?
If there's a gender sexuality alliance, they used to be called gay straight alliances in their school, that's a place that they can plug into, which should be safe, whether no matter which letter of the alphabet soup they belong to, LGBTQIA plus plus. So that would be the first place I would recommend going. The next would be to find out whether or not there are any either virtual or in-person support groups near where they live. I think we've sort of moved away from some of those, not just because of COVID, but I think people feel like there are other ways that youth and adolescents can get those needs met. Another place where if they're not getting the kind of sexuality education that they need, talk to their parents about participating in an Our Whole Lives program through their local Unitarian Universalist congregation, because they will get good, accurate information, and that can help them in understanding their bodies as well as learning how to relate to their peers. Because, of course, one of the things that begins happening with puberty, which I know is coming younger and younger and younger, is then we start having these sexual feelings toward one another. And what do I do with that? How do I respond? And how do I negotiate what I'm going to do or not going to do? And the Our Whole Lives or OWL programs do a really wonderful job at providing that level of education that people might need. So those are hopefully three places that people can find resources. And of course, if ever they're in crisis, certainly they can call the Trevor Project, but now we have a 3-digit number for the suicide hotline, which is 988. And they can call that 24 hours a day, 7 days a week, and somebody will be on the other end of the line to help de-escalate the whatever it is that they're feeling in that moment that they need support for.
Speaking of that 3-digit number, I'm so glad they switched to a 3-digit number. The other number was like long and like nobody remembers that off the top of their head.
Yeah.
So, but I was surprised actually when they rolled that out because I didn't hear a peep until the day of. So I've been trying to send that to everybody I know. So thank you for mentioning it.
Yeah.
Yeah.
Yeah. They had talked about trying to get rid of the barriers to creating another 3-digit number like that and the costs associated with it. And ultimately, it was in the gun violence bill that passed after the Uvalde shootings at the federal level. That's where the final funding for the hotline, the 3-digit number hotline, finally came out. And it's literally millions of dollars that they're going to be putting now toward the hotline to make sure that there's adequate staffing, and so that when anybody picks up their phone and dials 988, there's somebody there to answer.
Yeah, I heard staffing was an issue with that. I mean, well, it makes sense. I feel like it's very short term, the amount of time that you can work there. I mean, those are some serious calls.
Yeah, yeah.
But yeah, and if you guys ever need any other sort of resource, our website, which is www.thecomblog.com, and then you do /resources. I think we almost have 50 up there now of just different verified LGBTQ affirming mental health resources, self-care resources, or maybe just resources to connect with other people in the community if you're feeling lonely. And all of those that we verified them and made sure that they are free to use. So you can always go check that out. And if you guys, want to keep up, or if you have any questions, you can follow us on Instagram. And I say this every episode because I despise it, but the handle is annoying, but here it is, at the.com.blog. And it's all lowercase. So that'll also be in the description below. And I think I'll add the what'd you say it was? Owl?
Our whole lives.
Our whole lives. I'll add that to the resource page, and I'll also put it in the description below. So yeah, do you have anything? I always say this. Do you have anything that you'd like to plug, so to speak, or say any final words?
I guess in terms of plugging something, there's a project that I started about 6 years ago called My Bandana Project. And the website is mybandanaproject.org. And if a trans person reaches out to me through that website, I'll send them a bandana with a postcard that has directions to tie that bandana. I tie it around my ankle. Tie that bandana around your ankle, take a picture of it, send that picture to a trusted friend. If that trusted friend doesn't hear from you by an agreed upon time, then they're supposed to call and check on your well-being, because we know that social connection is a protective factor around suicide. So if we can keep people who are having thoughts of ending their life connected with others, we may be able to stop them from making the decision to end their life.
That is amazing. I didn't, yeah, no, that'll also be on the resource page. I'm putting that on there too. That's really cool. That's a really good idea. But yeah, I'll have to check that out and send it to my friends. But all right. Well, I just wanted to thank you so much for, taking the time out of your day and coming on here. It means a lot to myself, but also the youth who listen, to be able to hear from people like you. So
I do have been able to be here.
well, thank you all for listening. And remember that if you have made it to the end of this episode, you can get service learning hours that can be put towards scholarships for high school and college. So just always keep that in the back of your minds if you're ever looking for those kind of opportunities. And with that, I think we can sign off. Bye, everyone.